So let's look at some of the most commonly asked questions in the internet now. Why is cancer so common nowadays? It's a complex question, but some of the complex questions have simple answers. Today, we are surrounded by carcinogens, whether it's in our food, whether it's in our environment, or whether it's habit. Is there a body part in which cancer cannot develop? No body part is actually fully immune of developing cancer, but the least one which is affected is the heart. Can you have cancer for years and not know it? Interestingly, science has shown that many people have lived and died with cancer even without knowing it. But these are typically seen in low-grade tumors like in thyroid or prostate cancers that some of these studies have shown. Is it true that we all have cancerous cells in our body? Well, that's not true. Well, what has been shown is that many cells have the potential to become cancerous. We all may have these cells lurking in our body. But because the immune systems are the key checkpoints in our body, they do not allow them to become cancer. Is cancer treatable? Yes, very much. Cancer is today completely treatable. And one of the things that we often say is even in stage 4, today cancer is completely treatable. What are some of the signs that cancer is growing in your body? I want all of you all to just, using your internet, Google caution. There are 7 signs of cancer. These are called the 7 important signs of cancer. But simply to help you understand, a sore throat, a ulcer, a swelling, any wound that doesn't heal classically signifies cancer if it persists for more than a month. Any particular of these symptoms that persist for more than a month need not always be cancer but could signify a chronic disease, one among which could be cancer. Does cancer have to spread all over the body for you to die? Oftentimes, that's not the only reason but an important reason. Cancer cells don't have a purpose and they like to feed on all the human body cells. So in that way, they make a person cachexic and weak, and living on all the nutrition the body has been provided to, it can lead to death. Are some people immune from cancer? This has been again a very interesting question on why a chronic smoker who smokes so much cigarettes per day doesn't get cancer and why a person who's got a teetotaler gets cancer. Again, I re-emphasize, cancer is a genetic disease. There is a genetic predisposition and a constant interplay of immune system. The difference here is when we say cancer is a genetic disease, it does not mean it's a hereditary disease. I may not have transferred it from my parents, but genetically what I acquire from my environment, from the food I eat, from the air I breathe, and from the environment and the lifestyle that I lead changes my genes. That keeps me vulnerable to tumors. How can you find out if you have cancer? If you are a high risk individual, that is a tobacco user, chronic alcohol user, or if you are using, or if you have a family history of cancer, you need to be cautious and not ignore symptoms, and may require screening as per the latest guidelines if you are women above 40 for breast cancer, cervical cancer, and in men for prostate cancers, oral cancers, or in very restricted cases when you have thyroid swellings, you may want to go and get yourself screened for thyroid cancers.